Hi guys, welcome to our vlog.
So we're gonna explain the chromosomal aberration and DNA mutation.
The situation of chromosomal aberration or how it happens.
Chromosomal aberrations refer to a structural or numerical changes in the chromosomes, which can lead to genetic disorders or abnormalities. These changes can occur due to various reasons, such as errors during DNA replication, exposure to certain chemicals or radiation, or genetic inheritance.
One common situation is during DNA reflection, which happen when cell divide or can occur during this process, leading to changes in the DNA sequence. Another situation is exposure to mutations, which are substances or factors that can cause mutation. These mutations can include certain chemical, radiation, or even some viruses. When cells are exposed to mutations, they can include changes in the DNA sequence.
This is the reasons and causes of chromosomal aberration and why it is happening. Inherited chromosomal abnormalities and exposure to mutagens. This is the reason and causes of DNA mutation and why it is happening.
Reflection errors and environmental factors.
This is the symptoms of chromosomal aberration if someone has it.
Birth defects. Chromosomal aberrations can cause structural abnormalities in the body, leading to physical birth defects such as heart defects, cleft palate, limb abnormalities, or facial dysmorphia.
Intellectual and developmental disabilities. Many chromosomal aberrations are associated with intellectual and developmental disabilities. This can range from mild learning difficulties to severe cognitive impairments affecting language development, motor skills, and overall cognitive function.
Growth and developmental delays. Chromosomal aberration can also result in growth deficiencies and delayed development. This can manifest in delayed physical growth and delayed milestones, such as walking or talking, or delayed puberty.
Reproductive issues. Some chromosomal aberrations can cause reproductive problems such as infertility, recurrent miscarriage, or birth of children with chromosomal abnormalities.
Developmental abnormalities. Certain DNA mutations can lead to developmental abnormalities, such as birth defects, intellectual disabilities, or growth disorders.
Increased risk of cancer. Some DNA mutation can increase the risk of developing certain types of cancer. This mutation can disturb genes involved in cell growth regulation, leading to uncontrolled cell division and tumor formation.
Neurological symptoms. DNA mutation can also affect the nervous system and lead to the virus. Neurological symptoms include seizures, movement disorders, cognitive impairment, or psychiatric condition.
Metabolic disorders. Mutations in genes responsible for metabolic processes can result in metabolic disorder. This disorder can affect how the body breaks down and utilizes nutrients, leading to symptoms such as abnormal weight gain or loss, metabolic acidosis, or organ dysfunctions. This is the general ways to avoid mutation in chromosomal aberration. Avoid exposure to mutagenic agents. Certain chemicals, radiation, and environmental factors can increase the risk of chromosomal aberrations. Minimizing exposure to these agents can help reduce the chance of aberrations occurring.
maintain a healthy lifestyle. A healthy lifestyle including regular exercise, a balanced diet, and stress management can contribute to overall health, reduce the risk of chromosomal abnormalities.
Genetic counseling and testing. If you have a family history of chromosomal abnormalities or are planning to have children, genetic counseling and testing can provide valuable information. This can help identify any potential risks and guide decisions regarding family planning.
Avoidance of harmful substances during pregnancy. Certain substances such as alcohol, tobacco, and certain medication can increase the risk of chromosomal abnormalities involving fetuses. It is important to avoid these substances during pregnancy to minimize the chance of aberration. This is the general ways to avoid mutation in DNA mutation.
Immutable data structures. Using data structures that cannot be modified once created, such as tuplets or frozen sets. This prevents accidentally modification.
Avoid global variables. Global variables can be easily accessed and modified from anywhere in your code, leading to unintended mutations. Instead, use local variables or encapsulate data within classes or functions. Use coins or final keywords. In some programming language, you can use keywords like cons or final to declare variables that cannot be changed after initialization. This helps enforce mutability.
Functional programming. Functional programming emphasizes the use of pure functions that do not modify data. Instead, they return new values based on the input. This approach avoids mutation that can make code more modular and easier to reason about.
Thank you for watching.
We hope you learned something. Bye!